And today I'm excited to have Jacob. Jacob is from US Health. They have alternative options for those who make so much money they don't get a tax credit. And some of you may be going, why do we offer this? You I do tell people, if somebody walks into my office, they make $500,000 and they see their bill and it's $1,000. And they're like, that's just so expensive. How come I don't get a tax credit? And they're kind of crabby. And we all have had those, right? I do tell them you're paying the same percentage as everybody else in the country. You're paying about 10% of your income or less. Sometimes they go, oh, okay, that's fair. And then, of course, sometimes they're like, yeah, well, I don't want to pay that because I'm super healthy. I don't go to the doctor, right? So I firmly believe in options. The more options I can give my clients, the better. So now that short term is getting changed, Jacob, I met at the North American conference, 3 weeks ago? Seems like forever ago. And they have solutions. And I know there's lots of people that you hear on Facebook saying, oh, these aren't legit and shout. And sometimes it's like, that seems too good to be true. So what's the cons, right? We want to know, as I've told you before, clients don't care if there's a negative as long as they know there's a negative. If there is one, what's the negative of the Affordable Care Act? The rates or network may not be there. The deductible goes up every year, except next year, the deductible's going down for the max out of pocket. But they don't want surprises. You don't like surprises, right? So I brought Jacob on because he knows about this way more than me, because that's what he does. And instead of it just being my team and then you guys, me trying to regurgitate what he told me, I'd much rather have it come right from the horse's mouth. So Jacob, go ahead and introduce a couple questions for you. Is
Yeah.
How long have you been in the insurance world?
I've been in the insurance world since 2005. So I've been
Okay,
specifically in how I started in health and then got distracted by life and upfront commissions and mortgages back in, like 2006.
sure.
And then after that whole collapse happened, I was like, why did I ever get out of the health game? So I went back to the health game 2009. I've been there ever since. And so I was there pre-ACA, the transition into ACA, and then where we're at today. But I started as a general agency for the ACA because we didn't have ACA alternatives. That market hadn't started yet. I really kind of figured out healthcare.gov, and that's where I got my start. So very familiar with how, the entire, marketplace works. Where this platform started really was in 2015, fall of 2015, because ACA was beginning to, crumble in a lot of states. Florida, everybody lost their income overnight. I'm here in St. Louis. We sold Cigna plans back then that had lifetime commission guarantees for the life of the product. And of course, they changed the product to follow an open enrollment, and everybody went to 0% commission here. So that happened at one point, and so I really jumped into the health share arena back then, which was the only ACA alternative, and that's where our platform started. And so it's really built from ground zero, health share, where that was the only ACA alternative to what the market is today. So, we still have a lot of agents that think we're just a health share organization, and we're totally not. It's a small piece of our business, but it's certainly a piece of our business that's viable. But over the years, we really just started building around that model, and it's exciting to see where our industry is today, because the ACA alternative, arena has really developed, quite well into full major medical. You can get PPOs that don't exist on healthcare.gov, and there's something for someone that wants to spend an arm and a leg, and there's something for someone that doesn't want, that's bare bones and just wants just a very inexpensive catastrophic offering. Or there's also something for someone that maybe is getting heavily subsidized on the ACA, but they can't get their doctor in network on a bronze, right? And we can supplement ACA marketplace plans with plans that can offer unlimited office visits, on a PPO network. So we're really built for everything, if you will. That's the biggest challenge, I think, for agents that start with us, is there's so many products. And why is there so many products? And it's because every product speaks to a specific consumer type. What I wanted to build for everyone is the ability for you to really have this entire industry, single sourced, and that way, when someone comes to you, you'll have a solution that fits just about every consumer, outside of the ACA world. So that's where we built the company. That's where we're going to continue to grow, and that's why we partnered with North American, because it's outgrown me, it's outgrown us. I can't keep up with the growth, and so that's where Andy and his team are really helping us add to capacity for our broker services and some additional back end stuff to keep growing. So
for those of you that know, US Health used to be kind of, like I said, it was his own independent thing over here. And North American is an FMO. We like them. They're small, kind of a boutique. I'm one of their advisor boards for the Affordable Care Act. I'm still proud that I got Andy to understand that the Affordable Care Act was a wonderful thing and shouldn't ignore it. And they recently just partnered. It's been what, 4 months? I think
4 months.
well,
Yeah.
4 months. And so one of the things I'm going to have Jacob on one of my group sessions later is this is also something that can be used for a group chassis where you got a small group of two, right? They're just two people and they really want a group policy, but maybe the major meds are just stupid expensive or they're not in the network. So we can also do that. We'll talk about later in a group one if you're interested in group. But so you don't have to be, none of your other contracts, if you're like, well, I really like my FMO over here, that's fine. You don't have to like lose everything and join North American. But we have a really easy contracting and we'll send that. So there is a question. Marshall said US health plans are not US health advisors.
Correct.
Right? Are those two
Get
different
that question a
companies?
lot in the Texas market. No, we are absolutely not US Health Advisors. I had no idea that we were naming our company so similar. We even used to have a freedom plan, which was even worse because they have one too. So no, we're not. Completely separate companies, different business.
Completely separate companies. So if you've heard bad things about US Health Advisors, this is not them.
I tried to meet with them. They wouldn't even talk to me. So no, we have nothing to do.
Okay. So Jacob, show us your plan. Show us your chassis and what we should do.
Cool. Let me share my screen here real quick. Find which screen I put this on. Screen 5. There we go. So really, I got to click share. I always forget on Zoom. It's not like
there you go.
All right, there we go. So really, as I was saying, we are a single sourced ACA alternative platform, whether that be for the individual enrollments or even group business. And I don't want to call group ACA alternative because while we do have some ACA alternatives in the group space, we do have true traditional group, self-funded, level funded, PPO, all that stuff. I don't want to get too bogged down on that today, but just know that a lot of our plans that you see on the individual side are also duplicated on the group side. So if you think you can't do individual or you think you can't do group, as soon as you learn one, you really know the products on the other side of the coin. It's just the way it's distributed, to an employer versus an individual. And so we're not the insurance carrier, although in our platform, we do act as the level one because everything is single enrolled through us. We single bill everything. And then we play level one member service for all the plans on our platform. So especially in the ACA alternative world, that's really where I've been able to kind of beat the competition, is a lot of ACA alternatives are just sold to a member and have to figure it out with the claims payer. And that's kind of where you hear maybe some horror stories or people get lost. They have multiple different plans. They don't, and that's what I really started day one. When I first saw that the consumer was getting lost, I created the level one member service where we're tapped into all the claims payers while your member is going to work with the plan directly. If at any time, they feel lost, they have questions, it's one phone number, one email address for everything. Just reach out to us. We can make it so much easier and really help and go to work on their behalf. And that's going to happen at times in the ACA alternative world, depending on what plans you're selling. But there's going to be other plans that that are very, very user friendly. So we are a dual platform individual group. The main thing that I wanted to touch on is just like Chris said, we're a single contract. We act as an administrator. Like I said, we're not the carrier. And so even though you may see different insurance companies on our platform that maybe you have a contract with, we do not compete with anything because the products that we have, most of them are issued specific to a population that we're managing, or a group of members that we manage. And so that does not compete with any, marketplace contracts or short-term medical, whatever other contracts you have. We don't compete there. So everything you see is one single contract, takes 10 to 15 minutes, and you're done. And it's just stock. You get everything. So product availability, it ranges, like I said, from full-blown major medical PPO, which we have a lot of marketplace agents that don't think that that's possible, or, like you were saying, Chris, it can't be real. And it is. These plans have now been around for about 3 years. Really all the plans that are on our platform, some of these you may have heard of, some of them you may not have. Really, almost virtually everything on our platform is sitting on A-rated paper. There is an A-rated insurance company behind all the plans. The only one I can't say has A-rated insurance behind is a HealthShare. Yep.
So you did cut out a little bit, and then somebody's requesting, you can, if you can you put it on presentation mode? It'll make your screen bigger.
Yeah. Do this. Thought I did. Maybe
I know, especially when you're doing screen sharing with PowerPoints,
Yep.
it does weird things.
Yep. I'm drawing a blank all of a sudden how to put it on presentation. Let me do this.
Slideshow?
Is that what it was?
I think it's slideshow, and then
you think I'd
over on the top left, right there, hit slide. Yep, to the left.
There, oh, there it is. I see what you're saying. Slide.
Yeah.
I'm not seeing it.
Go up. Go up. Now over to the right too.
To the
slide slow up.
Oh, slideshow on the tab. Sorry, I was looking at the.
There you go.
Not now. Okay, it's my first day.
That's all right.
I guess
if you can't do it, then it just is what it is. But
there we go.
This is still bigger than it was. There we go.
Yep.
All right.
All right, there we go. So, oh yeah, that's right. That's what I do next. I lose the ability to highlight. No worries. Anyway, CMS HealthShare would be the only thing that's not A-rated paper. Again, there is a market for HealthShare. It's not for every consumer. I just want you to know it's there. Where it works very well. So it just has to be the right type of person, but otherwise everything else is insurance. Everything says A-rated paper behind it. So when we look at our platform, I really see it as in 3 different buckets. And this is the easiest way I can break down what we're doing. I got the bucket over here, bucket 1. This is really the major medical bucket. This is where, I prefer everybody to go into a major medical bucket. You can't beat major medical, especially if you're running on a PPO chassis. Where it's like a Visa card. It's going to get accepted just about everywhere in every market. There's going to be a few hospital systems that aren't in there, but whether you're using the Cigna PPO network or the Gig Care PPO network, which runs on Blue Cross, those are so widely accepted. And that's really where we solve a huge problem in the ACA. Is I'm in St. Louis, the biggest medical system in the Midwest, or in this tri-state area. It's Barnes WashU, and you can't go to healthcare.gov and get it. It's just not an option. And everybody in the rural areas, if they're coming to St. Louis for treatment, which they are, when the they're all sent to those hospitals, right? And so that's where PPO can really be a huge advantage. And that same dynamic exists in Houston and in a lot of other cities across the country. You lose those top tier systems. So. Now you're going to pay for it. They're not subsidized, but what we do find is you don't have to be making $300,000, $400,000, $500,000 a year. I mean, you can take a 45-year-old that's making, $80,000 a year or $70,000 a year, and they're not getting a subsidy. They're single. There's a lot of people that are not officially divorced and they can't get a subsidy because they can't, do the joint application. There's a lot of reasons for this, but there's also a lot of consumers that don't want to pay for ACA. They just want a traditional PPO back. And I used to fight that trend because it was so expensive. I used to be, save money on health insurance, and it's our top seller. It's pretty wild. So that bucket's there for major medical. And then the next bucket is really more of your limited med type plans, because as much as I want
I
everybody
have
to
a
be,
question.
yep,
Of those first two, so one says underwritten and one
mhm.
says simplified. So the underwritten is if somebody's super healthy, that's going to be less expensive than the America's Choice simplified, right?
I wouldn't say super healthy. I would say average health. If
Average health. Okay.
someone's in average health, most of the time, not all the times, but most of the time, they're going to get a better rate on the Cigna with the Cigna PPO
Okay.
offering. And it's to each their own. I mean, we've made the
Sure.
underwriting process really simple. Typically, you're going to get an answer within 2 business days, sometimes same business day. I mean, at the longest, it's 3. Very simple process, but some agents don't want to deal with that. They want to just go through the health questions and go through. But you pay a little bit for that, so it just depends. But
Okay.
and there's going to be some cases where there's some network that can be picked up on one plan that's not on the other. It's not widespread, but for the most part, it's the underwritten rate is producing a better rate for someone. So, but that's the other thing is, when you go to the bucket 2, where we're talking about the limited medicals, like I said, I prefer everybody to be here, but 1, not everybody can qualify, and 2, not everybody can afford it, right? And it's great that major medical is unlimited, but unlimited is absolutely worthless if you can't afford unlimited. And so you have to have limited medical options, right? And so these are our preferred. We're always looking for better options when they come around, but that's kind of the beauty of our platform is when there's something better, you'll see it here. But these are the industry best at this time. So it really kind of goes into what does a member want when you get into limited medical? Do they want greater upfront benefits? Or do they want better catastrophic benefits? And we don't need to solve that problem today and figure out all these plans. Again, it's more of kind of identify who your buyer is, and then you can really learn plans that way. I would always lead here with major medical until you find out they can't afford it or they can't qualify, and then to me it's, well, why can't you afford it, and then why can't you qualify? And that really tells you which plan to start looking at here, right? Over here on the right hand side, our third bucket, those are the MEC type plans, the office visit type plans. These can pair very well with an ACA bronze. Instead of trying to pay for a silver plan to get a lower deductible, a lot of times, or pay for a higher cost bronze to keep your doctor in network, a lot of times the math makes sense to go to the least expensive bronze.
So this is the one you were talking about. They're in Florida, bronze plan, the cheap rate, the one they can afford, doesn't cover anybody. They could get this. So the bronze is their catastrophic. I'm going to the hospital, go in the net. But you want to see 2 specialists that are out of the network. This is what you would use.
Yep, you got it. And that's especially, and specialist is really where a big hangup is in the ACA, because it is tough to get the specialist you want, or maybe the one that's being recommended if you're having some serious health ailments and you find out that it's not even an option to see them. So
Yeah,
that's
some
where,
states are definitely worse than other states.
very true, very true. And so a plan like this, where we have, for instance, our premium health that runs on PHCS and First Health, so you get a dual network on that. It's really hard to not find your doctor or your specialist in it. Another good example would be the OB. A lot of times it's, when you have a whole family, it's difficult to be able to get the pediatrician and the OB in the same network. And, that's a plan like that can solve that for a family, especially if they're leaving an employer plan where they're used to having a full network and they're coming into the ACA for the first time and they're going, wait, what? They got a whole family of doctors they can't put into one plan. So kind of taking a closer look, was there any other questions on this, or did you want me to keep moving here, or?
Keep going. There's questions will be coming, but well, this one is for what we just talked about. Is the MEC office plan an indemnity plan?
It's not. All of our plans are paying providers directly. That's a great question. Sometimes they look like they're a reimbursement plan or indemnity. They're not. We put a card in the member's hand. They go in and use it, and it works just like a traditional medical plan. And so if you are pairing it with ACA, you give them 2 cards and you can say, this card's for your everyday needs, your labs, your imaging, your specialist, your preventative. And then when the sky's falling, that's where you're using your ACA bronze, if you will. So
And the limited med, is that if I pull up the brochure, is it really clear what those limits are? Because I typically limited med means you only get 3 days in the hospital, or there's 10 doctor visits and not. Is that what the limited med is, or what? Can you speak real quickly? What is limiting? Is it $1 million
yeah,
of coverage versus unlimited coverage? Like, what are those limited meds, medical
so it
that's
really
out there?
depends on which plan you're going with. So let me see if I can pull up. I don't know
So if we're
where my,
not doing the simplified issue that covers pre-X, because of course, if we can get a pre-X covered, we want that.
yep.
And I'm assuming 11 knockout questions are the same for most. Are you currently in cancer? Have you, or current chronic illnesses? Have you had cancer in the last 5? Heart, those and ones, but it's really knowing what is the limit.
Yep. So if we look at Bronze USA, for example, the limits, just like you said, would really be the number of visits or the days in the hospital, right? Because like this plan will give you, 5 days in the hospital and 2 surgeries a year. Probably need to zoom in a little bit, right? So this, in a plan like this, the limitation is the available days, right? Now, everything that's within an available, like everything's covered 100%. That's why the plan does not have an annual limitation in terms of actual benefit that it'll pay out. Its limitation resides on the number of days in the hospital. The first 5 days you're covered 100% after a $350 copay. Day 6, you're out of luck, right? Now, on the flip side, if you go over to a health share, which obviously it's not insurance, I do consider it a limited med. Let me go back to this. Actually, this will be better. If you look at health share, for example, the limitation is defined as 1 million, right? So you have 100%
Right.
sharing for outpatient treatment, surgery, hospitalization. So within this, you have a 2750 member responsibility. You have a $1 million sharing benefit. That's lifetime. So the limitation would be 1 million, and the limitation would be no primary care specialist, stuff like that. So again, that's where our platform also gives you the ability to customize and design, because we talked about those MEC type benefits. You can supplement ACA. Well, if you're writing health share, you can also use that to supplement health share, right? Because it doesn't have office visits, you can add them, right? And while a combination of a MEC type plan to add office visits, so now the office visit portion is unlimited, so now your limitation is coming down to $1 million of hospital. While that may not make sense on the member only, you start getting into the family rates at 1,000, versus major medical, which may be 1,800 or 2,000. Again, it gets to that point where if you're a family, you may not be able to afford, $1,700, $1,800 a month, but you can afford 1,000, right? And so some members like the safety net of a health share. Some members like the safety net of having an insurance company behind them. But like I just showed you, you do sacrifice catastrophic, because the defined limitation would be day 6, right? Or in the silver plan, it would be day 8 in the hospital. Now, when you get into major medical, those limitations are off the table. The limitation in major medical is cost, and it's deductible and max out of pocket, right? So major medical is much simpler. It's just like the ACA. The difference being that there's no subsidy attached to it. And so, you really have to define, first of all, who is your buyer? And typically, our typical customer, they're going to be age 40 plus. They're going to be self-employed most of the time, but not all the time. That's a lot of times where the disposable income is. It's where the insurance buyer is for non-subsidized products. So although sometimes we have agents look at this and they go, I would never sell that. The ACA is way less. Agree. For an 18 to 39-year-old, the ACA is, not, can be a lot, less expensive than this. And that's why our platform exists, is you're never going to have one product that solves everybody's problems. It's totally impossible to do. But when you start looking into this age bracket right here, which is a huge buyer, to go PPO, and you can get a $7,300 deductible, fully loaded with copays on the Cigna PPO network. That's, when you call a doctor and you say you have Cigna, they go, do you have Cigna Connect, or do you have Cigna PPO? And that's a very big difference in answer, because the Cigna Connect means marketplace, and they'll say, oh, we don't accept that. As soon as you say employer PPO, oh yeah, we can get you in next week. Of course, it's one of the highest paying contracts out there. So,
and this is looking at these rates. I mean, I know Wisconsin, you guys know your state, somebody in their 60s by themselves for a bronze plan is going to pay $800. So versus $663, or if they want a richer plan, they can pay $844 for a $2,500 copay. So these rates, at least in my state and the states that we sell in, are not unreasonable. Yes, the 18 to 39 might be, right? The 18-year-old, it might be $300 on the marketplace. And I know we're like, dang it, the short term's gone and they're not going to pay $577. Okay, then don't offer this. This is not appropriate for them. So it's going to be when it makes sense. Would you rather pay $800 or $600 for a major medical plan, right?
Yeah.
So one question,
and that's really in a lot of states. I mean, most states, we're finding these rates on the 50 and 60-year-old are beating the HMO rates, or the EPO rates, which are just a fancy HMO. They're beating those rates on marketplace. And sometimes you'll find a member that maybe they're subsidized and their bronze rate is $350 after their subsidy, or $400. They're willing to pay more and get PPO. We see that a lot too. So
yes, certain states, absolutely. So one person said, if an employer has employees in multiple states, how does that work? Because that can work in all states, right?
Yeah. So we have this product available on an individual basis in 39 states and DC. It's uniform. That's something that's really nice about our platform, is virtually every product you see is uniform in all the states that we're in, which all of our core medicals are in those 39 states and DC. When it comes to an employer, from an employer standpoint, the employer just needs to be in one of the 39 states that we're in. The employees can be anywhere, because on an individual basis, the cert is issued to the individual, which means they need to be in the state. On an employer basis, the cert is issued to the employer, which means as long as the employer is in one of those states, their employees can be anywhere, because that is one difference between groups. So yeah, as long as the employer is in one of those states, you don't have to worry about it. We can cover them anywhere.
Do these work for people who are over 65 and they're waiting for Part B?
Our plans
so you have to be 64, right? 64 and under.
Yep. All of our plans stop at 65. I mean, I hate advertising it, but technically you could go health share over 65. I absolutely wouldn't, just because if you can get into Medicare, you really need to be there. But all of our
do these auto renew? So that was the question. Do they auto renew? I do know that you can pair these with ACA, that MEC policy. You're not necessarily going to want to pick a major with a major, but the MEC with the marketplace.
Yep.
And you can do it for people who don't want the ACA, but does this auto, do I have to reach out to them every year, or is it just going to stick in?
So on the major medical side, they're not going to auto renew. Let me put it this way. They will auto renew. We'll send them a new rate. Sometimes rates stay the same. Sometimes they go up. All members are guaranteed 12 months of coverage. We can't guarantee beyond 12 months. The renewal has to come in. Once they have a renewal, if they accept the renewal, they're guaranteed another 12 months of coverage. So as far as the renewal process is, I mean, really it comes down to, is the member going to pay for their new rate that's offered, or are they not?
Okay.
Most of
so
them,
it's technically out. We're telling you, here's your new rate, and if you don't turn off your payment because you yep, I just keep it, we don't necessarily have to reach out. But if they call us going, hey, they got this new rate, do I want it? And we're gonna go, yep, that's just the rate. They can either say, I don't want that rate anymore, or they just keep paying.
That's correct. If they don't call in to cancel, yes, we are going to auto renew them. If they call in to cancel, then obviously we wouldn't. that is their chance to change plans, because maybe they were in a $7,000 deductible this year and they could move to a 5,000 if they want, or, from a 5,000 to a 7. So renewal is their chance to do that. But yeah, they'll auto renew otherwise. When you get into the simplified issue, the guaranteed issue plans, or at least the the MEC and these limited meds, those are going to auto renew. Yes, there can be rate changes. These limited medical, I mean, the health share, it's had one rate increase in like 6 years, 7 years. These have had, we've only raised rates on new members. We've never had to raise rates on existing members. So these limited medicals, they're structured different, where really they just kind of roll over and people keep paying the same rate. But the mix for sure.
And I haven't looked, but I'm sure the question is, what are the 32 states that you're in?
Let me see.
If you've got that slide.
I'd say really it's every population center besides New York and
Are you in Cali?
yes.
Okay.
And I'm pulling it up right now.
And some of the limited states like Washington, Oregon, the state exchange ones, are you in those? Not New York, I heard, but you're in Cali, which is a state exchange. So
yep. Here's our no-sale states right here.
There you go. Cheaper. Easier to show the no sale, right?
Yes, it is. Yeah, so we got a pretty wide map, widely accepted. And that really trails just about every product. Gig Care, America's Choice. They don't have Washington and California. I'm looking at the Cigna offering right now. But yeah, these are now when you get into some of our ancillary plans like the accident and stuff like that, that varies by state more. But at least the core medicals are very uniform.
So Gwen said this, and this is something that needs to be addressed, right? This will be one of the elephants in the room. So I saw some comments on Facebook about America's Choice being a group health plan that are marketed to individuals. According to that person, Texas doesn't like those plans and they're going to go away in Texas. And I've also heard him say, and it's going to come back and hurt you as the agent. So I guess, what are your thoughts on that? How is that? Is that true? Not true?
So our entire model, the only way that ACA alternatives work is you have to run through an association, a limited partnership, a captive, or a state filed product, ACA being state filed. And we do have a few state filed products, but when you run through an association, limited partnership, working owner model, they all are group products. By definition, they are. So when individuals join the association, the limited partnership, whatever mechanism makes it legal for them to join into a group on an individual basis, that is correct. They are all, at the end of the day, technically a group product. So I don't know if I agree with the statement. I mean, everything's always underneath, anything outside the ACA is always going to be underneath scrutiny, right? As far as our product structure, for the federal courts in Fort Worth held up the decision. I think it was in 21 or 22 that the working owner model stands. That runway is there for us. And that's why it really was after that decision at the federal level why you're now seeing EBA, major medical, why you're now seeing America's Choice, because that really solidified the path forward for companies to build around. As far as them going after the agents, I really haven't seen it. The only people I've ever seen get in any trouble in our industry are big marketers that are selling plans wrong. People were selling health share wrong. They went after some of the bigger call centers that were selling it as major medical, stuff like that. But I've never seen it on from the agent side.
And personally,
Texas
probably is like, yeah, bring it in, because they don't like anything, right? So this is, I mean,
Texas is the only state
stuff.
Texas is the only state where we have 100% product availability. It is a very wide open state.
So anybody says Texas isn't like this, I don't think they know Texas. But these associations have been around. I mean, I've sold dental plans through these associations. They're not new. So the person is deemed that group. They're going to pay, part of what they're paying is towards that association charge. So it's not like they're lying that they're in this group, and it is part of the association.
Yeah.
And so
for that model to work in the association world, the association has to be filed with the state. The state has to approve them to allow the benefits. So I mean, yeah, and that's another reason I would say work with us, because I've been around this industry long enough. I mean, there's products can pop up and disappear, and those aren't the relationships I'm working with. You know, I'm working with really good associations and, you know, and partners that are filed correctly. So I'm pretty confident.
And people can join any time of the year, right? There's no
Correct.
like, "Oop, here's the open enrollment period." So this is a great one. I'm assuming next, okay, maybe I shouldn't assume because it makes an ass out of you and me, but that the marketplace is going to turn back on the documentation showing that you have a special enrollment period. It's off for various reasons. I've talked about in previous things, the millions of people that lost Medicaid. There was no way they could have a third party looking at the piece of paper. Yes, you lost coverage. So, but those at the end of this year, we go back to whatever that is. And so we will be looking at having to either provide documentation or we can sign up for these. So before we jump to ancillary, because I'm all about ancillary, we got a couple more questions. So I'm going to ask, Jill has kind of part two questions. So the first one is, I'm confused on two fronts about the PPO and PHCS. Joining an association or an LLC for insurance purposes only, I've understood that to be problematic, which we've already talked about. How the IRS treats this, what documents are provided to the consumer for tax filings? An individual or family can get on a group plan and have access to PPO, they must be self-employed, right?
Um, it's preferred they're self-employed, but on most of our plans, technically no, because technically the paperwork makes them self-employed. So if anybody, you know, and I will say the America's Choice plan, their plan structure does require self-employed. Coming in, being self-employed prior to you enrolling. The rest of the plans don't have that requirement.
So there you go. So there's one. And my concern is the way these plans are funded, excluding the health share. How do you decide which plans to make available on your portal? And what trainings do you offer on these plans? And do these include the cons for each of these plans?
So, you know, really rely on our broker service for right now. We're going to be doing plan specific trainings. That's going to be more released toward as we get closer to open enrollment. Right now, we're preparing, we're revising the plans for open enrollment. So there are going to be some tweaks that occur between now and October for 12/1s. So once that's all done and we've got that solidified, we'll start doing more trainings and developing some more pros and cons stuff. But you know, really, you know, if you're looking at, I mean, you could sit here all day and look at pros and cons of every single plan. And really the best thing to start is, you know, who is your member, you know, and are they a major medical buyer? Then it's simple to go, if it's major medical, then we just need to talk about what are the pros and cons between these two, right? You know, right now I can say huge pro is you'll see this benefit summary. This has specialty drugs. This does not, right? Cost is generally going to be better, but you know, has some extra state availability. Other than that, I mean, the plans are very, very similar in nature. It's major medical. They're both PPOs. At least the gig care is. So there's America's Choice, which is PHCS, and there's gig care, which is PPO. So America's Choice is available. I'm not PHCS runs on a reference-based pricing chassis. I'm not the biggest fan of that. I like PPO. If you're spending the money for major medical, get a PPO. If you're trying to save money versus going reference-based pricing, there in a lot of cases, health share can outperform reference-based pricing. It just depends on you know, who you are. But hope that answered that question. I know that was a pretty broad question.
And I know Jill is like many other people, and I'm going to tell you, you can get so hung up trying to figure out every single detail about every plan before you sell it. Don't do that because you're never going to sell it. Look at the major med. Figure out those two. Which one is that going to work for? Which won't it work for? And then just start there. And then you're going to get somebody's like, well, that's too expensive. I want something less expensive than the marketplace and less expensive than that. All right, let me look at these other ones. But if you don't start selling it, you're never going to know 100%. I mean, I've sold products that have worked for years and years and years just fine. And then one person comes and goes, hey, guess what? This didn't work for me. And I'm like, oh, well, that's something new I would never have known. Recently, we found out from Palic, their critical illness, the person had a stroke, but they had no permanent leftover residuals from that stroke that affected their health. So they didn't pay for the critical illness policy. I never knew that. But that was such a weird one-off. I mean, you know, like, hey, I hope you have a stroke that causes permanent damage. You know, I'm not, so you don't wait until you know these 100%. look at the brochures, put it in the back of your brain. This is what I have for that person that the marketplace doesn't work for.
Yeah.
And one question, and this is kind of an interesting one. So somebody signs up May 1st.
Mhm.
Is their deductible through May 1st through April, or does it May through December and then it resets January? Because you talked about guaranteed 12 months. Is it calendar year? Is it, how does that work?
So on the individual side, it's going to be calendar year. When we're doing it in
Okay.
a W-2 group side, it's going to be, based on the plan year, based
When
on
they
the
start.
plan year. Yeah.
Okay.
So, yeah, the guaranteed coverage for 12 months, the deductible resets on everybody on January 1st. So really it's,
Okay.
the second year you get a more of a full shake, if you will. It depends on
Right.
when you come in. The best time
So
to
it's
come
it's
in is
lining up
obviously
like the marketplace. I mean, that's just like the marketplace. I mean,
correct.
so okay.
Yep, correct.
And auto renewals, once they're in it, they're in it. There's no more underwriting. They don't get kicked out because they were healthy and then they had a heart attack and they're in that Cigna EPO. They don't go, sorry, now you're too expensive, right? They're just,
The
or
plan
did
does
they?
retain the right to re-underwrite.
Okay. So if somebody underwrites and they call you and go, hey, it's December 31st and Cigna's not going to keep me anymore. All right, we're probably going to put you on the marketplace
The other thing to keep in
because you're
mind is
really sick. Yes, sir.
if anybody would lose coverage here, it is SEP. It goes back to group coverage, losing qualified group coverage, because these are all group policies. So keep that in mind that someone's not, won't be left high and dry. They'll have a qualified event if they're not offered coverage. Because they would be losing coverage on a verified group policy without, and it's not for non-payment of premium, it would be for a non-offer. Now, to date, we haven't had anybody not offered. The pools are running very good, but I can't guarantee after 12 months that someone will be offered coverage. At this point, everyone is getting a contract for 12 months on the major medical side.
Sure.
Okay. The other plans, the limited meds are different. Health share, once you're in, you're in. I mean, that's a huge benefit of health share. You're in, and you're at family rates of 400 and 500 bucks. So is there holes and limitations here? Yes, there are, but that's your job as an insurance agent to fill them. Add a critical illness
Thinking of
policy,
doing this,
visits.
if you're thinking about doing the health share, as we've said, some of them are the most horrible things that have ever hit the planet, and some are good. They've been around, but that's because they structured it correctly. But you cannot call it deductibles. You cannot call it max out of pockets. You have to learn the language of a med share. So that kind of goes into one person is like, are you going to create individual details of each one of these plans? So somebody can go on your portal, or you're going to send out, hey, if you want to learn about CMS Health Share, you've got a pre-recorded, here's everything about that. Do you already have that, or?
I had to pull everything down because a lot of the information was so old that we'll have updated ones coming for this open enrollment once we finalize the benefits on every single plan. This is that time of the year where all plans make changes for what's going to be sold on January 1st. But all the plan listings are on the enrollment site, brochures, limitations. I mean, everything's here. You got every product. This is really the best source that I can say. I would say if you have more in-depth questions, get on our calendars, and we can have more of a defined conversation, 40-minute conversation, if you will, to really pick through some of these. But the thing that I would do is I would start figuring out, if you're looking at a specific plan, pull the documents, and then get with us on whatever specifics you have. Hopefully
All right, so go into your ancillary.
Cool.
This is one of the other nice things about this platform is you can layer all in one spot. Makes it easy for the client. Oh, because if anybody's watched me, heard me, I'm always saying layer, protect them. So if you're going to do that MEC policy and maybe the marketplace, a 9,000 out of pocket's expensive. So get them a layer so that if they end up having an accident, it's going to cover that. So here you can show what you've got for the layers.
Yep. So our preferred ancillary is our Zurich stack. It's really tough to beat these prices and benefit. I think accident AME is a no-brainer versus, on really any policy you're selling. And the best way to sell accident AME is you either commit to it or you don't. Because if you're going to buy an accident plan this year and then not the next year and buy it down the road, the house is going to win. If you just buy an accident plan and keep it every year, it would. If you don't, if you have an accident, sometimes in the next like 20 or 25 years, you win. So it's really hard not to, not to win on these things. But anyhow, I like the Zurich Accident AME, the 7,500 version. It's right at $25. Critical illness, again, 10,000. It's right at $25, $26. Those price points are hitting the max out of pocket or the deductible, easy to stack. If you want to add some hospital indemnity, you can. If you want to add some disability, you can. And again, if you were writing this with health share, it's single stack, single enrolled with the health share. If you're writing it with the major medical, it's single stack, single enrolled with the major medical. And your success on getting ancillary in our model is at the original point of sale. If once those ancillaries are in the shopping cart and they are enrolled and we are single billing them, I am telling you, I think maybe we had one member last year call and say, hey, can I please remove the accident plan and keep everything else? It just doesn't happen. Once it's in the bucket, it's on there typically for the life of the member while we have them. So the more you can sell those up front, the better that you'll keep them down the road. And it's such a benefit to the member because we see so much potential utilization for an accident plan. And when we see someone that's got a high deductible and they didn't have an accident plan and they cut themselves in the kitchen and they had to run to the ER and get an emergency surgery, all this, and you're just going, oh my goodness, that was so easy. Or I'm in the Midwest, you slip on ice, like it's easy.
You just need to offer it. Just offer it. And this platform does make it easy because you're showing them the major med, you're showing them whatever, and then you can go, and then here's an accident, just click it. Because as I've said before, people walk in with a number in their head. It's usually Cobra, the rate they have in their head. So they have this number in their head. Don't ask them what the number is because then they get suspicious. Just put this on there and they're going to see, oh, the rate's $900. Sweet. That's 600 less than I was planning. So just put it in there. Just offer it. Explain it why you're doing this. Like you said, in the Midwest, you fall on the ladder. Hey, you're retiring. I bet you that honey-do list is pretty big. Just put it on there and then let them tell you to take it off.
Yep.
And disability income, I cannot emphasize this enough, offer it to anybody who doesn't have it at work. Whether they're self-employed, now obviously if they're not working, they're retired, they're not going to get a disability income. But if they are working and they don't have it at their job, whether they're a part-timer who doesn't get it or they're self-employed, just offer it. Because I'm running into a woman who now is desperate to try and find a guaranteed plan because she hurt herself and I don't have anything for her and she's worried about losing her house. So just offer it.
Yep, absolutely agree. And what I do want to say is, depending on when you go to our enrollment site, you're going to select your state, and the state's automatically going to filter for all the product availability. The Zurich products are not available in all states. They're available in the more favorable states, and that's why they're there, and that's why their costs are so low. If you start getting some other states, you may see that we have different dentals, or we have different different critical illness or a different accident plan, and that's just because we can't make Zurich available there. So we do have additional plans there. It's kind of confusing for someone that may be in a Texas or a Missouri or somewhere where we have full availability, and they're going, why do we have these two different plans? But can you write them both? Yeah, if you have someone on Marketplace and you want to add the NSCL guaranteed issue critical illness, and you want to add the Zurich critical illness, you can check both. And then you got guaranteed issue, $20,000 of critical illness. If you're working with a business owner, I really like, we have Washington National, we have cancer only plans. That's simplified issue. You can go up to $100,000 lump sum on cancer only. That's a huge benefit. A lot of times business owners don't think about the fact that if you get cancer, that it's really going to make their income suffer, not have the ability to work a lot of times, and to get $100K. That's a big deal. So although that's not a guaranteed issue product, these are the Zurich products we looked at. These are all guaranteed issue. It is there, so you can you can get more creative if you want. Actually, a benefit on Washington National while I'm here. This, by the way, this is the only product we don't have level compensation on. So be aware that everything else on our platform is level comp. This is more of the traditional ancillary of high first year, low second year. They do have Hospital Assure. This is really good for someone in their 30s because I think that price is usually around $30-$40 a month or so. That pays out lump sum upon hospitalization, and maternity is included in that. So that is a really big selling point for females in their 30s to add the hospital assure. Pairs very well with marketplace as well. Again, someone's on a $0 bronze, and you just write a $5,000 benefit for maternity reasons. So that's which would also work for any other hospitalization.
Is this considered credible coverage for Medicare?
No, it's not.
Okay.
Well, you talking about the ancillary plans, or were you talking about?
No, the major med. So at the health insurance, they're on that Cigna PPO, and they're 64 and a half. Some, and not my state, but I guess some states, the supplement will look at a 6-month pre if they're not in a qualified plan.
Yeah, I see what you're saying. I guess on aging in, that theoretically shouldn't be an issue. I guess that's probably after the age in. I have to assume yes. I can't guarantee that. I haven't been asked that question. It's a great question. Knowing that they are verified group insurance policies, I don't see where someone could say that that's not a qualifying policy, because when you get your coverage, it looks exactly like your employer's plan. So I don't see where they would be able to block that, but I can't sit here today and say, oh, for sure, 100%. But I don't.
So can somebody sell just the accident as a standalone, or does it have to be paired with one of the medicals?
Everything can be sold standalone. Everything is a la carte.
So there you go.
And
there's your guaranteed issues right there.
Even applies in the group side. Now the core medical, we're going to make, if we do it on the group side, we'll make the core medical plan. They've got to choose, one of their core medical plans. But outside of that, you get into ancillary, even in group, everything's a la carte, whatever they want, no participations.
All right. So talk about when somebody's with you, they're with you, renewal, you're the agent of record, they're not going to do that. I do see a timer going down, which there shouldn't be, but it might be because Jacob's co-host. So for some reason it disappears, everybody. Just log back on. But go into how commissions work. And I'm getting out the link so you guys can all get this. I did this last week, 2 weeks ago. Super, super easy contract.
Yep. So compensation is uniform through the whole field. So you don't have to worry about someone, you're going to get better comp if you go from someone or you come to us direct. Compensation is absolutely uniform for the entire platform. We'll look at the Cigna PPO offering with EBA. The producer comp is level. Like I said, all compensation in our model is level. The only exception to that rule is Washington National. But other than that, everything's level. So member only is going to pay you $80 a month. Member family is going to pay you $115. That's stock. And then, once you reach a top producer status with our organization, which would be either 30 enrollments of one product or 60 enrollments of two, then if you are top producer for that one product, for example, if you wrote 30 of these, then we would make you top producer for, just this product line. If you wrote, I think it's 60, don't quote me on that. I got to look at the contract. If you wrote 60, then you'd have it with two, it would qualify you for the whole entire platform. So obviously we're going to reward you just for writing business with us. Once you've written that kind of business with us, then we're willing to work on much lower margins and, pass that on to you. And we'll increase your compensation. So once you have 30 of these, you would go from 80 to 90. And that doesn't mean your 31st household, you're at 90. That means we're just going to pay you 90 on all 30 retroactive, not, starting that day. So on your entire book. So, that's really our built-in bonus structure, if you will, to produce. So every product's, a little bit different in compensation. America's Choice, we've got that at 88, which you can, top out at 96 once you're top producer there. And then everyone also has the ability to earn 3 levels of overrides. We want everyone to have the ability to build a general agency within us. And so, if, all you have to do is send out your link, refer another agent to us, and that agent's going to get the exact same deal you've got. When you write, the Cigna offering, you're going to get $80. When they write it, they're going to get $80. The difference is that you're going to make an $8 override because you referred them to our organization. We can either run this huge expensive marketing campaign, or we can just pay you all. And it's it's a lot funner to pay you all because, we can all grow business together versus giving it to, whoever. So that's how our model's been built. And it does add up. We've got, I lost my page, sorry. We have agents that don't write any business. They literally only refer, and that's it. And they earn, solid income with us. We have some agents that don't, and they just write business. But if you focus on writing a household or two a month, and you focus on referring an agent or two a month, it gets really, really hard to screw up the math in this model. It just all, kind of happens. And
So I put the link in the chat. When it says, how did you find, put my name, let me get the override. It doesn't change your comp at all. And hey, you have somebody else in your organization that does it, you send it to them, then you get the override. So go ahead and stick my name in there. It's not going to cheat anything, and I would appreciate it. But this is great. These are level, and it's year after year after year, you get the same level. That's one of the nice things. It's very similar to the marketplace. So these are comparable. Obviously, we make a little more commission on this, which is nice. If you're just like selling a short term, we make more money on a short term than we did on the marketplace. Never sell a product because of the commission.
Correct.
You always do what's right. And if you do what's right, and this is what's right for them, you get rewarded by having a bit of higher commission. So I put the link in the chat for those who are going to be on YouTube. I will have it in the notes.
And we won't process a contract unless there's a name in the referral link. It's got to be there. Otherwise, you're just going to hold it up, because we'll have to reach out to you, figure out where you came from, all that stuff. And then, every product's different, but this even applies with ancillary. I'm just showcasing 4 products here, but any product that goes in the shopping cart has the levels of overrides, and it all ends up, we're a transactional business. So contracting is very easy. It's going to take you about 10-15 minutes. And
that's easy.
Yeah, and then it'll take us typically about 3 business days to push our enrollment site, or push your enrollment site to you, because we just got to verify you are who you are, you got a license, you got to, then we got to set up your site, code it, push it out to you. So that turn time is about 3 days, typically less right now. And you're off to the races. So.
And if you have LOA agents like me, licensed only agents, it could take a little bit longer, but they can do that too. You just got to let them know ahead of time. So looks like we have 1 minute left. Any questions? I think we answered most of them. And Jacob, you are absolutely willing to talk to anybody. Hey, I've got this one question, either contracting or, hey, this bronze plan, I see this one thing. Can you explain it to me? Is it better to reach out to you, or is it just the customer service at USA Health? I mean,
we've got to run through broker service and our customer service. I don't have the ability to be on every phone call. I mean, I'm building this whole platform in the background, and there's a lot of sleepless nights. I would say, start with our level 1 broker service, get the questions you can get answered there. If you have more questions, move to our level 2. You can book on a calendar, go to our level 2 broker service, and then at that point, if there's something really deep and outstanding that we can't get answered in that framework, then yes, absolutely, I'll get on a call, but we have to go through those channels first. Otherwise there won't be an opportunity for everybody, because there's thousands of brokers.
Well, right. We can't just wait for Jacob. Nope, totally understand, which is why I'm asking. So there is a whole broker compensation. And if you're, reach out to me, North American, whoever it is that you have the contract through, which if you're doing it through me, it's going to be North American. If there's a question, you feel like it's not getting answered or whatnot, we'll get it there. These have been around for how long now, Jacob?
What's that?
Have you been selling them? That you've been selling these?
I mean, every plan's a little bit different. I mean, the major medical plans, they're about 3 years old, and that's just really because of the market dynamic of some favorable regulation. And then, the health share, I built this health share offering with Altrua. They're a CMS recognized. This offering 6 years old. The pool behind this, though, is 23 years old. That's why you always want to use a CMS recognized health share, because that means CMS is actually looking at the accounting. Otherwise, you can have different horror stories. These MEC plans, these have been around for, I think we're about 6 years on, 5 or 6 years on those. Some of the other limited meds, they're 4 or 5-ish years. So most everything's at least got a 3-year track record on it. And that's the one thing that you have to do. You have to be aware of. Full disclosure: when you're coming in the ACA alternative world, it's not completely static. Like the state filed world, but even with healthcare.gov, all the plans change every year. It's very rarely does the plan roll over and you got the exact same benefit or plan. So plans are going to change from time to time. That is a real benefit of our platform, is that your member is housed with our platform. So we own it. And I'm not just saying USA owns it. You and I own it. We own the member together. So if a plan changes and it's not going to be around in the future, it's very easy for us to just press a button and switch them to a different plan, right? Or if another plan comes on in the future and you're like, well, although well premium's great, I like this different MEC plan that you brought on for open enrollment. I want to move my 10 members. We'll just press a button and move all 10 members. So it allows us to really steer and drive. So I hope that helps answer that question.
One last question. Who is EBA? And you can turn off the screen share.
Okay.
Yeah. Who is EBA?
EBA is the Employer Business Association. So that is the mechanism that members are joining to get that group policy.
Okay. So there you go. So Employer Business Association. So these plans, they're not new. They've been around. We didn't just make these yesterday. Jacob's actually just been doing this, and it's been growing and doing so well that now we're finding out more and more about it. So now you talk to them, you've heard it. The naysayers who are like, this isn't a real thing. It's not new. And if the laws change, just like with short term, then we'll address it when that happens. But don't put somebody in a plan because it might change.
Yeah.
They all might change, right? But they can sign up for now and it'll be fine. So thank you so much. They're over the limit. I know a lot of you got to get going. This will be on YouTube. Jacob, I appreciate so much for you coming on and answering some questions. And we're always looking for those alternative options. So I really appreciate it.
Cool. Look forward to working with everybody and help develop your business on this side. Really appreciate your time.
Chris,
yes.
Are these all an e-app or are they paper?
Oh, it's all e. There's no paper.
Paper's illegal in my company. We don't.
I'm not. No. There's no paper.
All right. Thanks.
All right. Thanks, everybody.
Yeah, see ya.